Healthcare in Uganda by Bailey Ressler, Jessica Ratnaraja, and Dawit G.
Uganda has come a long way since integrating mental health services into primary care. However, misconception and stigma are still some of the challenges Ugandans continue to face. Advancements in mental health services began after Uganda achieved independence in 1964, and the country has surpassed their Millennial Development Goals by reducing poverty and increasing life expectancy. This reduction in poverty has resulted in increased investment in healthcare, including investments in mental health services. Up to 35% of Ugandan citizens suffer from a mental health condition, and just under half will require treatment. Here we have the story of Akiki, who is working towards overcoming her depression and anxiety as a result of her diagnosis of HIV/AIDS.
I was a very vibrant kid, always really happy, and I was also the youngest of 7 kids. But I was always compared to them, and it made me really sad. When I got a little older, I was comparing myself to those in the community, and it really affected my self-esteem. So yeah, I remember thinking at the age of 13 that I wasn't good enough, and at the age of 17, I was diagnosed with depression.
Depression is described as a mental health disorder which negatively affects how an individual is feeling, the way they think, and how they act. It causes feelings of sadness and/or loss of interest in activities once enjoyed and can lead to a variety of emotional and physical problems.
When I found out I was HIV positive, I started self-harming to ease the pain, and I started hiding the cuts underneath my clothing so my mother wouldn't find out. But she soon did, and she took me to the community healer. She thought evil spirits were telling me to act this way.
Uganda is very traditional. It has been recognized that traditional healing exists side by side with modern medical practices in Uganda. These traditional beliefs regarding mental health create a boundary for many to overcome, also leading many not to seek treatment. Often, traditional healers will use methods of chaining or tying for periods of time, as it is believed to ward off spirits.
It has been reported that nearly 80% of Ugandans facing mental health issues have previously seen a traditional healer, often delaying the onset of evidence-based care.
It wasn't until I was 22 when I first entered the mental health hospital. The medication prescribed helped me with my mood and even stopped me from cutting myself.
Medical experts say multiple social, psychological, and biological factors determine one's level of mental health at any point of time.
The prevalence of malaria, HIV/AIDS, tuberculosis, and even diarrheal disease can contribute towards the effects of mental illness. For example, if a patient is diagnosed with HIV/AIDS, they have 22% chance of also being diagnosed with clinical depression. In recent years, Uganda had a new legislation prepared, however it was never introduced. There have been many different approaches used to support the mentally ill and their families with the aim of reducing disability and poverty. The initiative in Mayuge, rural Uganda, has integrated mental health care into primary health care. Although it met resource barriers, it did report progress on support and development of strong service user support.
I entered the institution at the age of 22 and have been working on recovery since.
Akiki's case is very interesting. She entered the group support psychotherapy program. The program is new and is used to target the management of depressive symptoms occurring in patients also diagnosed with HIV/AIDS. 70% of patients have substantial recovery.
Programs like the one Akiki accessed hope to see up to 20% of patients experience lower rates of poverty as a result of increased productivity due to their being able to access care. While Akiki managed to gain access to mental health services, many Ugandans still struggle in their quest for access, and about 1/3 of the population lives more than 5 kilometers away from a clinic or hospital, and access is still not guaranteed even if they can get there.
Akiki's story highlights the challenges an individual can face in their battle with mental illness throughout their quest for services. While Ugandans still face challenges in accessing mental health services in the country, Akiki's story can help to identify the advances in care and the improvements Ugandans can experience as a result of access to mental health services.